Now we talk about some set of neuromuscular issues. That's like issues affecting how your nerves and muscles should be communicating. So this is what is known as a spinal muscular atrophy. Okay, so of course the nerves and the muscles are not connecting very well, so the muscles are kind of like what, fading away. That's atrophying. So spinal muscular atrophy, you see it, the person is weak. Okay, all of that. So it's a group of genetic neuromuscular disorders. Just like I was telling you guys, it's not a single disease condition. We have different types. So it can cause progressive muscle weakness and atrophy due to loss of motor neurons in the spinal cord and the brainstem. So the nerves that are supposed to be connecting or communicating with the muscles are being lost. Do you understand? So it's one of the most common genetic causes of infant mortality. So a baby is so weak, the baby is in a position that they don't like, but they can't change. This kills children, right? Sudden infant death. So causes and genetics, there's a mutation in a gene known as the survival motor neuron 1 gene. Okay, it's autosomal recessive. So there's mutations or deletion in that gene. Okay, so there's a deficiency of a protein known as the survival motor neuron protein. That protein is to keep your nerves healthy. So if your nerves are not healthy, the communication is breached and you're having muscle weakness. Okay, so have different types. Now this is just an introductory lecture. We get to talk about each of these types. We have the prenatal type, we have the Werdnig Hoffmann type, we have the Dubowitz type, we have the Kugelberg and the Welander type. Then we have the adult type that comes up in when you're around 20 years and 30 years. You can pause to look at a summary of the abilities and prognosis. Okay, we'll talk about them, don't worry. So general symptoms is muscle weakness, hypotonia. If it's in a baby, the baby is floppy, weak. Okay, delayed motor milestones, fasciculations, breathing issues, swallowing issues, progressive loss of mobility. You diagnose it by confirming that there's a mutation in the SMN1 gene. Okay, then electromyography, you are trying to see how the muscles and the nerves are still communicating. Then clinical examination. So you treat it using all those disease modifying therapies, all those genetic drugs. Nursing, then the Onset gene Abepavovec. Okay, then the RIS-D plan. So supportive care, respiratory support, nutritional support, physiotherapy, and orthopedic interventions.